Which of the following is the most effective way to prevent dispensing the wrong medication to a patient? A. Relying on memory during busy shifts. B. Double-checking the National Drug Code (NDC) number. C. Asking another technician to confirm the patient's identity only. D. Using abbreviations on labels to save time. Answer: B. Verifying the NDC number is the most reliable method to ensure the correct medication is dispensed because it identifies the drug, strength, and manufacturer. Relying on memory or abbreviations increases risk of error, while confirming patient identity alone does not verify medication accuracy. A patient is prescribed metoprolol but is accidentally dispensed metoclopramide. This type of error is classified as A. Look-alike error. B. Sound-alike error. C. Omission error. D. Monitoring error. Answer: B. Metoprolol and metoclopramide are sound-alike medications, leading to potential confusion. Sound-alike and look-alike drugs are a common source of dispensing errors, requiring tall man lettering or special alerts to minimize risks. When counseling is required but a pharmacist is unavailable, what should a pharmacy technician do? A. Provide counseling independently. B. Refuse to dispense the medication. C. Inform the patient that the pharmacist will contact them soon. D. Give the patient printed manufacturer information only. Answer: C. Pharmacy technicians are not legally permitted to counsel patients. If the pharmacist is unavailable, the technician should ensure the pharmacist follows up. Providing independent counseling could compromise patient safety and legal compliance. Which medication class requires use of a medication guide with every dispense due to high-risk side effects? A. Proton pump inhibitors. B. Statins. C. Antidepressants. D. Antihypertensives. Answer: C. Antidepressants, especially SSRIs and SNRIs, require a medication guide with each dispense due to risks of suicidality and serious adverse reactions. This ensures patients are aware of risks, reinforcing patient safety. What is the best way to handle a near-miss error in a pharmacy? A. Ignore it since no harm occurred. B. Report it through the pharmacy's quality assurance system. C. Document it only if the patient was affected. D. Correct it silently to avoid liability. Answer: B. Near misses should be reported and documented even when no harm occurs, because they provide opportunities to identify system weaknesses and prevent future errors. Ignoring or hiding such incidents reduces patient safety. A pharmacy technician notices that warfarin tablets are stored next to vitamin K tablets. What is the risk in this situation? A. Omission error. B. Storage error leading to potential mix-up. C. Expired medication dispensing. D. Labeling error. Answer: B. Warfarin, an anticoagulant, and vitamin K, a reversal agent, stored together may result in a mix-up during dispensing. Separating look-alike or clinically opposite drugs reduces the chance of errors. Which of the following actions reduces the risk of contamination during sterile compounding? A. Wearing jewelry under sterile gloves. B. Using first air principles inside the laminar flow hood. C. Placing items directly against the hood's HEPA filter. D. Talking loudly while compounding. Answer: B. First air principles ensure that sterile airflow is not obstructed, reducing contamination risk. Jewelry, contact with filters, and talking in the clean room increase particulate and microbial contamination. When verifying patient identity before dispensing, what two identifiers are most appropriate? A. Patient's name and date of birth. B. Patient's address and insurance number. C. Patient's physician's name and phone number. D. Patient's first name only. Answer: A. Name and date of birth are the safest identifiers to confirm patient identity. Insurance and physician details do not guarantee proper verification, and using only a first name risks dispensing errors. Which organization publishes the Do Not Use abbreviation list to reduce medication errors? A. USP. B. ISMP. C. FDA. D. The Joint Commission. Answer: D. The Joint Commission created the Do Not Use list to standardize safe communication and prevent dangerous misinterpretations of abbreviations. For example, U4 units is banned due to confusion with 0 or 4. A technician receives a prescription for insulin but notices the patient has no needles or syringes on record. What should the technician do? A. Dispense insulin only. B. Provide syringes without pharmacist approval. C. Alert the pharmacist about the missing supplies. D. Ignore it since patients usually have supplies. Answer: C. Insulin cannot be administered without proper supplies. The pharmacist should be alerted to address this gap and ensure the patient's therapy can be safely continued. Which step is most important in preventing cross-contamination during hazardous drug compounding? A. Doubling shelf life of the drug. B. Using dedicated equipment and negative pressure rooms. C. Wearing regular surgical masks. D. Keeping hazardous drugs in normal inventory shelves. Answer: B. Hazardous drug compounding requires negative pressure rooms and dedicated equipment to prevent exposure and contamination. Standard masks or regular storage methods are not sufficient. Which of the following is an example of a dispensing error? A. Giving amoxicillin instead of ampicillin. B. Failing to provide the patient counseling sheet. C. Patient refusing to take the medication. D. Physician writing an incorrect strength. Answer: A. Dispensing amoxicillin instead of ampicillin is a technician-related dispensing error. Errors in prescribing fall under prescriber errors, and patient refusal is not a dispensing issue. Which high-alert medication is associated with fatal errors if the decimal point is misplaced? A. Levothyroxine. B. Insulin. C. Acetaminophen. D. Amoxicillin. Answer: B. Insulin is a high-alert medication where decimal misplacement can cause underdosing or life-threatening overdosing. Clear labeling and avoiding trailing zeros reduce this risk. What is the main purpose of using tall man lettering, e.g., hydroxyzine versus hydralazine? A. To make the prescription look professional. B. To reduce confusion between look-alike drug names. C. To shorten the drug name. D. To increase marketing appeal. Answer: B. Tall man lettering highlights differences in look-alike names, reducing dispensing errors. It is a proven strategy supported by ISMP and FDA for medication safety. Which of the following should be reported as part of quality assurance? A. A mislabeled medication that was corrected before reaching the patient. B. A patient refusing counseling. C. A patient returning expired medication. D. A physician prescribing two compatible drugs. Answer: A. Even if corrected, a mislabeled medication must be reported as part of quality assurance. Such reports improve processes and prevent future risks. A prescription for morphine is missing the prescriber's DA number. What should the technician do? A. Fill the prescription anyway. B. Call the insurance company. C. Inform the pharmacist immediately. D. Add any DA number from past prescriptions. Answer: C. Controlled substances require a valid DA number. The technician must notify the pharmacist, who can verify or contact the prescriber. Entering a false number would be illegal and unsafe. Which storage condition is critical for vaccines like influenza? A. Room temperature on the counter. B. Refrigerated at 2 to 8 degrees Celsius. C. Frozen at -20 degrees Celsius. D. Kept under dry conditions in cabinets. Answer B. Vaccines such as influenza must be refrigerated between 2 to 8 degrees Celsius to maintain potency. Freezing or leaving them at room temperature can destroy their effectiveness. A technician must record refrigerator temperatures daily. This practice ensures A. Patient identity verification. B. Medication potency and safety. C. Compliance with billing requirements. D. Reduction of patient wait times. Answer B. Recording refrigerator temperatures ensures drugs remain within manufacturer-recommended storage ranges, maintaining potency and safety. Improper storage can render medications ineffective. If a patient reports a severe rash after starting a new medication, what should the technician do? A. Suggest the patient discontinue the drug immediately. B. Report it as an adverse drug event to the pharmacist. C. Refill the prescription again for monitoring. D. Ignore it since rashes are minor. Answer B. Technicians cannot recommend discontinuation but must immediately alert the pharmacist. A rash could signal a severe allergic reaction, making prompt reporting critical for patient safety. The best way to prevent mislabeling errors when printing multiple labels is to A. Print all labels at once and distribute later. B. Match each label to the prescription immediately. C. Ask patients to check their labels at home. D. Rely on memory to recall the correct order. Answer B. Matching each label to the prescription immediately avoids confusion and mix-ups. Delaying this step increases the chance of mislabeling errors. A technician finds that a controlled substance count is off by 2 tablets. What should be the first step? A. Ignore it since it is a small amount. B. Report it to the pharmacist immediately. C. Call the DA directly. D. Recount tomorrow to see if the issue fixes itself. Answer B. Any discrepancy in controlled substances must be reported immediately to the pharmacist. The pharmacist will then follow procedures for reconciliation and possibly report to DA if necessary. Ignoring discrepancies compromises patient safety and compliance. Which type of error occurs if a technician fails to include auxiliary labels on a prescription for metronidazole? A. Dispensing error. B. Prescribing error. C. Administration error. D. Monitoring error. Answer A. Omitting auxiliary labels, e.g., "Do not drink alcohol," is a dispensing error. Auxiliary labels are vital for safe patient use. Prescribing errors occur at the prescriber's end, while monitoring errors relate to follow-up care. Which of the following actions helps reduce transcription errors? A. Writing drug names from memory. B. Using verbal orders instead of written prescriptions. C. Entering prescriptions directly into the computer using e-prescriptions. D. Accepting unclear handwriting without clarification. Answer C. E-prescriptions reduce transcription errors caused by illegible handwriting or misinterpretation. Accepting unclear prescriptions without clarification is unsafe. A technician notices the wrong strength of lisinopril was entered into the computer. What should the technician do first? A. Correct the error without telling anyone. B. Report the error to the pharmacist immediately. C. Call the prescriber directly. D. Ignore it if the strength is close to the original. Answer B. The pharmacist must review and handle any errors in prescription entry. Technicians should never correct errors independently or ignore them, as wrong strengths can cause serious harm. Which of the following is a high-alert medication that requires special handling? A. Loratadine. B. Insulin. C. Amoxicillin. D. Vitamin D. Answer B. Insulin is considered high alert because small dosing errors can cause life-threatening hypo or hyperglycemia. Such drugs require double checks and patient education. The use of barcode scanning in pharmacies primarily improves A. Patient counseling. B. Insurance billing. C. Medication accuracy and safety. D. Inventory pricing. Answer C. Barcode scanning ensures the correct medication, dose, and strength are dispensed. This technology reduces human error and is a key tool in patient safety systems. Which action is appropriate if a patient insists on taking leftover antibiotics for a new illness? A. Encourage them to do so to save money. B. Remind them antibiotics can be reused for similar symptoms. C. Inform the pharmacist to provide appropriate counseling. D. Dispense additional antibiotics without a prescription. Answer C. Only the pharmacist can counsel on safe medication use. Leftover antibiotics may be expired, inappropriate, or cause resistance. The technician must escalate this to the pharmacist. When handling hazardous medications, why must double gloves and gowns be worn? A. To reduce skin irritation from cleaning solutions. B. To comply with billing standards. C. To protect staff from exposure and contamination. D. To make the pharmacy environment look professional. Answer C. Hazardous medications can be absorbed through the skin, causing long-term health risks. Double gloves, gowns, and PPE protect staff and maintain safety compliance. Which of the following is an example of a monitoring error? A. A patient's INR is not checked while on warfarin therapy. B. Dispensing ibuprofen instead of acetaminophen. C. Prescriber writing the wrong drug. D. Failure to attach a shake well label. Answer A. Monitoring errors occur when necessary follow-up, such as lab tests, are not performed. In warfarin therapy, INR monitoring is essential to prevent bleeding or clotting risks. What is the safest way to clarify an unclear prescription? A. Guess based on the prescriber's usual patterns. B. Ask the patient what they think it says. C. Call the prescriber directly. D. Use an online forum for confirmation. Answer C. Only the prescriber can clarify unclear prescriptions. Guessing or relying on patients is unsafe and may lead to medication errors. Which of the following increases the risk of medication errors during prescription entry? A. Use of tall man lettering. B. Interruptions and distractions. C. Double-checking entries. D. Standardized labeling practices. Answer B. Distractions and interruptions increase error risk during entry. Standardization, tall man lettering, and double-checking are safety practices to reduce errors. A patient asks if their new medication will cause dizziness. What should the technician do? A. Look it up and provide the answer directly. B. Refer the question to the pharmacist. C. Tell the patient it's unlikely without checking. D. Ignore the question. Answer B. Technicians cannot provide clinical counseling about side effects. Such questions must always be referred to the pharmacist to ensure accurate patient safety guidance. Which type of error occurs if a patient receives too low of a drug dose due to incorrect measurement during compounding? A. Omission error. B. Dosing error. C. Storage error. D. Prescribing error. Answer B. A dosing error occurs when the incorrect amount of medication is prepared or dispensed. This could lead to ineffective treatment or harm to the patient. The most effective way to handle expired medications in stock is to A. Keep them in inventory for emergencies. B. Relabel them with new dates. C. Remove and quarantine them for proper disposal. D. Sell them at discounted prices. Answer: C. Expired medications must be removed immediately and placed in quarantine until disposed of properly. Relabeling or selling expired drugs is illegal and unsafe. Why are insulin vials labeled with refrigerate so critical to store correctly? A. Because refrigeration increases shelf life by 10 years. B. Because room temperature doubles the potency. C. Because improper storage reduces medication effectiveness. D. Because refrigeration prevents cross-contamination. Answer: C. Insulin must be refrigerated to maintain potency. Failure to do so can lead to ineffective therapy and uncontrolled blood glucose levels. Which of the following should be avoided to reduce contamination in sterile compounding? A. Wearing sterile gowns and gloves. B. Touching vial stoppers without alcohol swabbing. C. Cleaning the hood before compounding. D. Allowing uninterrupted airflow inside the hood. Answer: B. Touching vial stoppers without alcohol swabbing introduces contamination. Sterile gowns, gloves, and proper hood maintenance are required for patient safety. A technician is preparing chemotherapy drugs. What is the correct location for this task? A. Standard laminar airflow hood. B. Negative pressure biological safety cabinet. C. Regular counter space. D. Refrigerator compounding area. Answer: B. Hazardous drugs like chemotherapy must be compounded in negative pressure biological safety cabinets to protect workers and prevent contamination. What is the safest response if a patient brings in a prescription written with U4 units? A. Dispense it as written. B. Assume it means micrograms. C. Clarify with the prescriber before processing. D. Change it to units on your own. Answer: C. Use on the Joint Commissions do not use lists due to risk of confusion with numbers, e.g., 0 or 4. The prescriber must be contacted for clarification. Which of the following safeguards helps prevent lookalike medication errors? A. Keeping similar drugs next to each other for convenience. B. Using tall man lettering in separate storage areas. C. Ignoring brand names entirely. D. Relying on patients to notice mistakes. Answer: B. Tall man lettering and separate storage minimize confusion between lookalike medications. Patient reliance or clustering increases error risk. Why should pharmacy staff participate in continuous quality improvement (CQI) programs? A. To meet insurance requirements. B. To avoid counseling responsibilities. C. To identify and correct error trends. D. To reduce prescription volume. Answer: C. CQI programs track errors, near misses, and workflow issues to enhance safety systems. This proactive approach ensures patient safety and reduces repeated mistakes.